Dear friends, good morning. Today we will talk about the medication we use to treat coronavirus infection in Cyprus. I'd like to tell you that they are only prescribed by the doctors. You cannot just go to the pharmacy and buy them. You cannot find them, and this would be wrong. First of all, I need to say that there is no currently established universal protocols of the treatment of coronavirus. All countries together and the World Health Organization looking for effective treatment with the highest possible outcome. So many studies, trials, approaches, experiments. Everybody today share their experience in order to achieve our common goal, to kill coronavirus. The new vaccine also has been promised by Chinese doctors and scientists by the end of April. Cyprus uses the protocols of treatment recommended by World Health Organization. 4 main drugs are in use so far, depending on severity of illness. With a mild form of coronavirus infection, there is no any special treatment required. You take some paracetamol, plenty of fluids, isolate yourself, have a rest. Here I would like to say about ibuprofen, Nurofen. Doctors recommend taking paracetamol, Panadol, in case of mild symptoms of coronavirus. It has been circulating in the internet news that Nurofen is strongly contraindicated, cannot be taken during pandemic of coronavirus. I need to say that all these thoughts, all this news have been disproved. This is not true. There is no any scientific evidence of contraindicated ibuprofen during coronavirus infections. In other words, the coronavirus is not linked directly to ibuprofen. Ibuprofen do not cause coronavirus to multiply, to replicate stronger, faster. No. All the scientific, parascientific news about this have been disproved. It's not true. But ibuprofen has ability to damp, to decrease, to reduce our body inflammatory response. That's why we call ibuprofen anti-inflammatory medicine. It is known that ibuprofen is contraindicated for some problems like asthma, some serious chest infection, respiratory distress syndrome, chronic problem of circulatory system. Because of this action to damp our own body anti-inflammatory response. Maybe that's why the using of ibuprofen was linked to the worsening of symptoms of respiratory distress syndrome, which is quite severe SARS, we call it, in the case of COVID-19 infection. But as I told you, there is no any scientific evidence, just some notices. So what we do? Wisely, we take paracetamol and we talk to our doctor, because for some people, even paracetamol is contraindicated. So whatever you want to take, whatever drug you want to take, please speak to your doctor. But for the moment, we do not use ibuprofen, Nurofen for a treatment of the mild symptoms of coronavirus. The moderate to severe forms, and for the patient from the risk group, like those over 65 years old age, chronic health problems, presence of mild dyspnea, combination of Plaquenil and azithromycin has been recommended. The Plaquenil is very old anti-malaria drug. It is also suitable for children, some form of it. But the Plaquenil has also very strong anti-inflammatory action. So for some patients with chronic rheumatoid arthritis, with lupus, some other autoimmune disorders, this is a drug of choice for many years. This is how our Chinese colleagues at the beginning of endemic of coronavirus noticed its effectiveness in coronavirus infection treatment. What they noticed, that some chronic patients who are on Plaquenil treatment for years either do not conduct at all coronavirus or do not have serious complications. This effect of Plaquenil was also confirmed by laboratory studies about Plaquenil in vivo and in vitro. Azithromycin, our macrolide antibiotic, works as a synergist in this case. It was also casual notice during the current endemic. So together, their effect in the treatment of coronavirus is stronger. Another group of drugs we use for treat coronavirus infection, as we say, not the mild but moderate or severe forms, are ritonavir and lopinavir. These are two antiviral drugs, relatively new, which are successfully used in the treatment of HIV infection. They are also appear to be effective in the treatment of coronavirus infection. They are taken by mouth. Two different also antiviral drugs, it's Japanese drug Avigan, favipiravir, and remdesivir. They are very promising and currently on trial for treatment of coronavirus infection, including Cyprus as well. The Avigan is usually taken by tablets, by mouth, and remdesivir was already tried in the time of Ebola virus epidemic in Africa and Zika virus epidemic in South America, and it's given by infusion in complicated cases. Dear friends, no need to say that researchers and scientists all over the world working day and night on finding new drugs, testing them, searching for maximum effectiveness and minimum adverse effects. It is not still clear if any of those potential drugs are really effective against coronavirus. There are controversial studies. None of the medication has currently sufficient evidence to be recommended 100%. Some found that monoclonal antibodies and immunity targeting drugs are also effective in the treatment of respiratory distress syndrome, the SARS as we say, caused by coronavirus. Also, transfusion of convalescent plasma in trial, where antibodies from the patient who recovered, who passed the coronavirus infection, can be collected, the plasma from them, the antibody in the plasma, and given for prevention or for treatment. Sure, the most desirable finale, however, it would be the invention of the new vaccine, which can give us immunity and prevent from the illness. Till then, stay safe, enjoy your day, care about your loved ones, and goodbye. Thank you very much.